I actually started off in neurosurgery residency, and it was during that time where I noticed I was really more interested in the diagnosis part and being able to medically manage these patients. I was really interested in the neurological emergency. So that brought me into vascular neurology. So I am a board certified vascular neurologist. So that covers all of cerebrovascular disease. Mainly I see ischemic strokes, hemorrhagic strokes. I will sometimes come across aneurysms or subarachnoid hemorrhages. And that's really my subspecialty. However, from stroke care, you also get overlapping migraines, epilepsy. My initial encounter with most patients is acutely in the hospital. People come in with stroke-like symptoms. From a patient's perspective, knowing that there's going to be a consistent person all the way through their hospitalization and then into the outpatient setting. It's that continuity of care that also builds the confidence of that patient because you're that one consistent person all the way through. Communication with a patient is very important. Being able to obtain a history is very important to understand how the pathology came about and the timeline, so to speak. And then being able to communicate to the family how one's trajectory or how a recovery process from an event like this can be knowledgeable for the family so they kind of know what to predict. And then not to be overly concerned when people haven't recovered, overnight. And that recovery can be, a rocky road. There might be good and bad days like everybody else has. To be able to know and support their loved one through that process with that understanding is important. When I see them in the clinic and they have started to recover and then their life is normalizing, that is really rewarding, and it fuels you to do more. I'm a big scuba diver. Actually, I'm a PADI certified dive master, and I have subspecialty training in taking people with disability diving.